Before we get started, a friendly reminder. The information discussed on this podcast is for entertainment and informational purposes only. While our guests are knowledgeable in their respective fields, your personal situation may require unique guidance. We encourage you to consult with a qualified professional for personalized advice. Now enjoy the episode. Hi, everybody. Welcome to another episode of AndWon Should Know, where we journey together to find tips and tricks to take better care of you.
Mm-hmm. And what are we talking about today?
What are we talking about today?
A lot of women are very shy when they talk about this, but it's
true.
It's something that most of us will go through at some point in our lives. Whether or not we give birth, whether or not we reach peri or the menopausal stage, today's topic pertains to every one of us at some point in our lives.
Agreed.
Right?
Yes. Are you too shy to say it? Fine, I'll say it. We are very delighted to be able to speak to somebody here today that does vaginal rejuvenation. So, with that, I would like to introduce Dr. Shirley Kui.
Welcome on board.
Hi, guys.
Welcome
Thanks
to
for having
AndWon Should
me.
Know.
Yes. So you're an aesthetic doctor,
Yes.
but you do specialize in vaginal rejuvenation. Maybe you could take us through what that actually is for the audience, just in case they don't know what that.
So vaginal rejuvenations, basically what we're trying to do is to kind of like bring back the vaginal state prior to childbirth or prior to the menopause itself, okay? Obviously, every woman will feel that something is wrong after like childbirth or even after like menopause, but they're too shy to say it.
Yes.
So what I do in aesthetic usually, because like they come in with a bit of a skin problem or they want to kind of like improve in terms of like their pigmentation, and then with time they get a bit more comfortable and then they start saying about, oh yeah, I have this issue also, doctor,
Right.
Yeah. So but what we do mostly are non-surgical.
Okay.
Non-surgical. So minimal downtime, very safe. Okay. So yeah.
And what actually causes this? When a woman gets too dry downstairs, down there. What causes this in our lives?
So in terms of like dryness, downstairs, okay, usually we associate that with menopause, okay, and women after the age of like 40, 45, or even 50, depending on when they reach the menopause itself, they will have like reduced level of the hormone estrogen. Hormone estrogen is what makes us women, okay? And when basically we start losing estrogen during menopause, then we have that reduced lubrications around the vagina, and also basically the inhibition of like the ability of the vagina to kind of like recover, okay? So that's why you get that dryness, a bit of pain, all these things, yeah.
So estrogen is the juicy hormone, essentially. It helps to
That's
juice
a good
us,
one.
right?
The juicy hormone.
Is what I'm
Juicy
hearing.
hormone. I like that, yeah.
Okay, so with the reduction of estrogen when you get a little bit older, that's why we do experience the vaginal dryness.
Yeah.
And then with the non-invasive surgery that is vaginal rejuvenation, what does that actually look like? What does the procedure look like?
So when patients come, obviously we take the history. We have to make sure that there's no like contraindications.
Yes.
So obviously patients with like significant pain or patients with like signs of like cancer, we have to make sure that we get them tested first. So usually most patients, I will ask them to have their recent pap smear test. And if it's negative, then we can proceed with the treatment. So the treatment itself is quite comfortable, okay? And what we do, we usually utilize radio frequency energy. So what it does, it causes like a deep heating of the vaginal tissue to about like 40 to about 45 degrees. Mm-hmm. At that temperature, you get the increased production of collagen and as well the sort of like new blood vessel regeneration. With that, you get the tightening, okay, as well as the lubrication. There are other ways as well for the non-invasive sort of like vagina rejuvenations. Usually some other place utilize laser energy. With laser, it can be a little bit more discomfort there because in terms of the heating, they're usually not so uniform. But laser sort of vagina rejuvenation has been around for more than 10 years. So a lot of people have been doing it. It's just that nobody talks about it.
Now, I know that generally most women who go through pregnancies, right,
Yeah.
they're the ones that would be, you know, most likely going to look for you to have the vaginal rejuvenation done. But what about women that actually just don't lubricate well down there, you know, that maybe haven't had, you know, children? Is that something that they could also experience and have
Yeah.
and get
Definitely.
juicy?
No, definitely. I mean, in terms of vagina rejuvenation, it's not exclusive to just those who have given birth, you
Okay.
know. So even we see women who don't have kids.
Right.
Sometimes with age, sometimes, you know, it's like with genetic lottery, you just don't know what's happening there,
Yes.
right? Yeah. They just experience like dryness, issues with like sexual intimacy.
Yes.
And they don't inform their partners
Yeah.
usually. They just like kind of like suffer in silence.
Yes.
Yeah. And this is where we are here for them, you know?
Yeah, exactly.
So, but yeah, in Singapore, it's getting a little bit more popular because
Yeah.
like people are starting to like speak up a bit more,
Right.
but it's not there yet, I think.
Ah, that's really good to know because I think you don't know what you don't know, right? And if
No,
no
of
one's
course.
talking about it and there's no conversation around it,
Yeah.
then how are women? Because it should be pleasurable for both sides. Like, you know, it can't just be a one-sided, you know, situation there.
Absolutely.
Well, apparently with the treatment, it also helps their partner to feel better during the
Oh.
intercourse.
Bonus.
That's what they say.
Oh, very good.
Very interesting.
That's very good to
I
know.
like today's topic.
I can see the
Juicy
excitement in
topic
Andrew's
all
face.
around, Andrea.
What about when we talk about prolapse? Is this something that people can seek help for as well?
For prolapse, I think usually we have to assess first, and depending on the severity of the prolapse. When you have prolapse, if it's very severe, usually you might not see much improvement with the non-surgical intervention. But if it's kind of like mild, it definitely helps. And I also always advise my patient to remember to do the pelvic floor muscle exercise, the Kegels.
That's what you're always asking me. Are you
doing
doing
your
your Kegels?
And you can do it even when you're working and nobody knows that you're doing it. It's just you look a bit stunned. So
Exactly. But is it, you know, if you do have prolapse,
Yeah.
as you were saying, it's,
Yeah.
you would have to do a series of checks to ensure if this rejuvenation is something that could actually
Yeah.
benefit. How does one actually get prolapse to begin with?
generally with prolapse, you have weakness of the pelvic floor muscle itself. Okay, that's the most common, and the most common cause for that is childbirth.
Childbirth.
Yeah, if you have kind of like a traumatic delivery. Okay, I mean you can't blame your gynae or anything, but I mean things happen during
Yeah.
delivery.
And by when you mention traumatic, what exactly do you mean by that? Like too many hours of labor, or during the time when you're pushing out the baby?
I think it's both.
Oh.
Yeah, hours of labor is like, in terms of like when you actually deliver the baby, you get the tear, you know.
I see.
Yeah, and then sometimes it's not just so-called like how do you say it, prolapse itself from childbirth. Usually you get like feeling of tightness because when they stitch after the vaginal tear, then you get like a little bit of like pain during intercourse, all these things. Yeah.
Because nerves don't forget, huh? Nerves don't forget pain, huh?
No, they don't.
Because a lot of women, when they experience pain during sexual intercourse,
Yeah.
before the act even happens,
Yeah.
you know, they are on high alert because they're thinking
true.
pain.
It's like a
pain,
PTSD,
pain.
right?
Yeah, it is like
Yes.
PTSD. That's
Yeah.
true.
So, and things get worse when we become wiser and
Yes.
older.
Yes.
Because of the estrogen drop. So,
Yes.
Right.
yeah. But I mean, if you want to kind of like assess in terms of like what's your estrogen level, you can do a blood test for that. There's always like what we call a hormone replacement therapy, and we have to make sure that you're suitable. So patients with history of like breast cancer or womb cancer, they shouldn't do hormone replacement therapy because that will increase the risk. So usually that's when they go to the non-invasive, which is basically utilizing the device, or maybe surgery. Yeah, so it all depends.
Right.
Back to HRT, even topical HRT would not be advisable if you've had a history of breast or womb cancer in your family.
For topical, it is much lower risk because in terms of the absorption into the systemic blood vessel, it's much, much, much lower. But sometimes patients just don't know how much they actually apply, you know, and sometimes when it's a bit too much, you definitely get a bit higher risk with that, and you get like symptoms of like too much estrogen. You get the headache, vomiting, so there's always, you know, you have to just be very sure
cautious.
that it's safe and very cautious about it.
Yeah.
That's true. What about when you know, for women that are actually considering these, you know, vaginal rejuvenation, is there something that is there a process prior to that? You know, obviously coming to see you for a consultation, but are there things that they need to cease and desist in order to optimize the success of the rejuvenation?
You're saying stop the sex, are you?
For a day.
What's the downtime?
There's not really downtime. With radio frequency, you don't get swelling or anything like that. So before the treatment, I mean, first thing first, don't do it during your period.
Right.
I think that's number one, right?
Yep.
And then make sure that you have your pap smear done, okay?
Right.
Every 3 years if everything has been normal, or depending on what your gynae tells you. But other than that, it's a fairly simple procedure. Okay?
Comfortable.
Yeah, you come into the clinic, and then basically we use like a probe that we actually insert into the vagina. The total active treatment time is only about 8 minutes. That's
No
for
way.
the inside of the vagina. Some patients also want to kind of like treat the, you know, the labia,
Yes.
you know, the lips, okay?
Yeah, the lips, yeah.
Yeah, because that also helps to kind of like improve the tightness around sort of like the orifice.
Yes.
And also for urinary incontinence, it helps.
Oh, really?
I probably am going through what a lot of women are going through.
Yep,
And
yep.
yes, it's affected my sex life with my husband.
Yeah.
I don't know how else better I could be a better wife when it comes to anything that happens in the bedroom. But this has given me hope. It truly has given me hope, and I hope for a lot of women too,
Yep.
that they will consider this, because there is help.
Yeah.
There is help.
Yeah. I think with this kind of treatment, some of them, they actually say like it's life-changing, you know, because when it's so painful, especially for sexual intercourse, you just don't want to do it, just like what you say. People have a bit of PTSD, they get panic, and then you just don't want to do it at all, right?
Well, the truth of the fact is, you know, you do it and then you feel so much pain while you're at it that you just don't enjoy it. And then for the next few days, you kind of really sore down there.
Yep.
And you're thinking to yourself, gosh, how can anyone go through this repeated sort of, it becomes like, you know, sex is supposed to be something you enjoy with your partner.
Correct.
You know, not something that's so painful that you go, I can't do this. I just can't do this.
Before I met Dr. Shirley, I didn't even know that this treatment existed. And I thought, my goodness, because I've heard so many stories, you know, my friends and that sort of thing, where, you know, sexual intercourse is very painful. And it's just, like you said, you know, luck of the draw with your genetics, right? Maybe
some don't
you're
have
just
it,
not
some have
so
it.
juicy down there. And then, right? Like, good to know, right? That there's help out there to make it more
Intimacy
juicy.
is very important in a relationship.
It is.
You know, I mean, this whole, you know, I love you, I fell in love with you, it was so hot, it was so steamy, it was just all so happening. But then as you go through many things in life, that sort of changes as well. I know it's not all about sex, but intimacy in a relationship, in a marriage, is so important.
I agree.
Is so important.
Definitely.
So, back to vaginal reconstruction. No, not reconstruction, rejuvenation. Is it a one-off thing?
No, actually. So, okay, with the radiofrequency treatment, the Axion, we recommend a set of about 3 sessions at the beginning, usually between 7 to 10 days between each treatment. And after that, it depends on how you feel. It's like you do more like a review every 3 to 6 months, and then you just do it one time every single time you come, just to kind of like, boost the lubrication, boost the so-called like the vaginal mucosa itself. Yeah.
Right.
Okay.
What about libido then? Does it boost your libido after you get it?
According to the study, yes.
Oh, maybe there's
You
no
can try
fear
it and then you let me know.
Yeah, because
Right.
you kind of your libido naturally drops
Yep.
when you go into menopause. It drops,
Okay.
So I'm just wondering how this also could help.
Yes. So when it increases the sort of like the
Sensitivity.
sensitivity, yes, the blood vessel around it, the lubrication, okay, and you don't feel panic during the sexual intercourse itself, it definitely makes women reach orgasm easier
Yep.
and improves the libido. Yeah.
Oh. I wonder if all of this actually comes to something, like it can improve. Not only does it increase, the lubrication portion, but also the libido. That's like a real bang for your buck
Yeah.
type
It's
of like treatment.
the whole set.
It's-
right?
yeah, it's like
it's
the
like
f- the
physical,
whole
mental,
shebang.
and everything. Yeah.
you know?
Yeah, I mean, part of me was thinking, man, I need to go and see a sex therapist or something. But now I figure I just go and see Dr. Shirley.
Exactly. And of course, like, we got a chance to visit your clinic, which is really nice because there's, privacy is of utmost
a big-
importance,
No, of
right?
course,
And I think
yeah.
this is a great thing that you've got a nice setup within your space so that you're not commingling with anybody else if you don't wish
You
to.
don't have to run into any friends.
Like,
exactly.
Nobody
Like,
knows
eh.
you're there.
You also come
Oh,
see
you're
Dr.
so
Shirley.
Private and confidential.
Yeah.
And we also have all female staff.
Girl power.
Girl power.
Yeah, I know.
Exactly. That's really well thought through because I think it is already something a little bit nerve wracking, because
No, I
people are
know,
shy.
I
So
know.
having the confines of a nice private space where nobody else is going to know what you're doing, right?
Yeah, because it's something that's so intimate and so private.
It is.
For me, I found it very, very hard to even see a male gynae.
Yeah.
Yeah.
I know.
That's true.
So now to have to go through something like this again, which has to do with my privates,
Yeah.
I think I definitely would feel a lot more comfortable if I went to see a female.
Exactly.
Yeah.
Which is nice. Is there anything else that, like any other treatments that go well, that pair nicely with vaginal rejuvenation that you would recommend?
I think at the end of the day, right, I mean, with so-called like vaginal rejuvenations, patients need to kind of feel confident about themselves,
Right.
And nowadays, the trend, basically, patients don't want to look like they've done something.
Right.
They just want to look great, but nobody knows what they did.
Just a little sprucing up.
Exactly. So I mean, in my clinic, we do things like anti-aging treatment. We do injectables, things like even Botox, fillers. But as I say, nowadays we don't overdo things. Okay, we just do a little bit here, a little bit there, and then basically you come out of the clinic, you feel like, oh, I look fresh,
Yeah.
But nobody knows that I did filler, or nobody knows that I did Botox, and of course, like things like our therapy, thermage. Okay, these are all the energy-based device that
And
help-
non-invasive.
Exactly.
Yeah.
No needle, no surgery, no downtime, So people come in like during lunchtime or over the weekend, and then they go back to work and nobody knows.
None the wiser. If you were saying this is non-invasive, the Althera
And thermage, yeah.
thermage, what is that? Is that for your face, for your...
So, okay, I mean, our therapy was initially intended to basically lift the face area. It is US FDA approved, it's safe, it's been around for about 15 years.
Okay.
So it utilizes ultrasound energy,
Okay.
micro focus ultrasound. It is a little bit painful, but we'll manage your pain, don't worry.
Oh my God.
So the treatment actually target what we call as the SMAS layer. It's basically the fascia that cover the muscle of your face, and it's the layer that all the facelift actually targets. Okay,
Oh.
so you get the effect of facelift without actually doing facelift.
Huh.
Ah.
Can you do it on your neck?
Yes, you can do it on the face, on the neck. You can even do it on the décolletage area. We have patients that do it around the buttock area for butt lift. Okay.
Really?
I know.
And look at Andrea. She's like, what?
She's like, revelation.
Do you have anything that you would recommend that is like non-invasive?
We do.
Like at all? Like where there's
Like no
zero
needles?
pain, like nothing.
That's for Yen.
Yeah, that's for me. I'm just like,
For the face,
Yeah.
okay, when we talk about like the skin rejuvenation,
Yes.
okay, we have laser. We have hybrid laser, no pain, okay? A little bit of pins and
Really?
needles, no pain. We have Axion, okay? So Axion, it has like 4 handpiece, okay? One of them is basically for the vagina rejuvenations.
okay.
And also we have something for like a skin tightening. And it's so comfortable. Most patients actually do it and they fall asleep. So
Okay, that sounds like my kind of thing. Andrea knows I'm like always worried about pain.
it's like, sign me up for that. We have facials, yeah.
Okay.
And I mean, I'm a believer of facials. I mean,
Me
you
too.
wash your face every day, but there are still some things that still remain in your pores, okay?
Yeah.
And you get whitehead, blackhead, okay? And if you don't know how to extract it properly, you get like marks or you get scar, yeah.
Right.
Or you get acne after that.
Yeah, nobody wants that.
Exactly.
Yeah, so facials are, I love facials. I'm a big fan of the, like, what did I do the other day? It was the one that's Rejuron or something like that.
Rejuven facial.
Yes, where it's like, but it's
Oh.
like not painful,
Yeah.
and it just gives your skin a boost.
What is it? What does it entail?
Apparently it's just like little. Maybe you can explain it better than me. But for me, from what I felt as a layman, not a doctor, I just literally felt like it was just warm, like just a warm. Like there was gel and there was a warm
yeah.
sensation
Yeah.
of almost like a massage that was going through your like with.
Oh,
her.
it's not
But it's a
needles
machine.
or
It's a
anything.
machine.
It's
but
a
like,
machine.
yeah.
So I think with the Vagina facial, what they do is they basically like use either like ultrasound or maybe like electrophoresis for like penetration of
Yeah.
the so-called Rejuven itself. So Rejuven came from Korea. They actually came from salmon DNA. Okay.
Oh.
But what it does,
Okay,
it basically stimulates skin rejuvenation. It works so well, okay, especially when we start using it like about 8 years ago. But we do it as an injection, but it's a bit more painful.
Yes,
Yeah.
I've heard that. the
So
injection.
now they actually have the so-called like a way of like penetrating, like the penetration itself using the sonar penetration.
Yeah.
So it's not painful. You feel a bit warm
Yeah.
or maybe cold sensation, and then you get the effect of the so-called Rejuven
Yeah,
without the pain.
not the pain. Exactly.
Which leads me now to this question that I've been really, really wanting somebody to clarify about fillers.
Yeah.
So there's this whole thing where you're reading on social media or seeing on TikTok or wherever that fillers migrate. So which fillers migrate then? The AHA, the hyaluronic, or the
Okay, so Profilo,
Right.
it's meant to spread.
Okay.
It will spread, and it's okay to spread.
okay?
Okay.
Because after a while, it just gets
It just
absorbed.
get absorbed. Exactly.
I see.
With fillers, if it's not placed properly, you get that so-called filler migration. So it moves to place that is not meant to be. And then you get maybe lumps here, lump there. Sometimes it form a little bit of like, kind of like, we call this like granuloma, okay? And it just stays there like for like a few years. Yeah, so there are patients that have done like fillers like long time ago, and then they say, how come I still feel lump around there, you know? So there are fillers that stays in like under the skin. It's not common, but it happens.
Because there's this thing termed pillow face that's going around a lot. That
Yeah.
they're saying a lot of these pillow-faced celebrities in Hollywood. Now, what is this term about? What is pillow face?
No, it's just too much volume.
Oh.
Way too much volume.
Where
I
it
mean,
doesn't look like you anymore.
exactly.
Oh my God. Okay.
I think with
face.
fillers, if it's done right, it'll do its job. But if it's not done well, and then what happens like in the like about 5-10 years ago, a lot of doctors like to inject a lot of filler, and they do like what we call as a liquid facelift. So instead of doing like things like Altera, they kind of like inject the filler to help to lift the face. But in order to do that, you actually inject quite a lot of fillers.
Right.
And usually what happens is, as what we mentioned just now, not all fillers will be metabolized. Some of them will stay there, you know. And patients like the effect, right, of the filler, the immediate lifting, the immediate feeling of the loss of volume. And they come back to the doctor 6 to 12 months later, and then the doctor is like, okay, we'll do the same thing. But like eventually you're like putting more and more, and then everything kind of stay. And because filler, especially with the HA filler, they absorb water, on certain days when you have a bit of water retention, you get like a bit of like kind of like
puffy.
Yeah, swelling, puffy.
Oh,
Yeah.
interesting.
Yeah.
Wow.
I'm not against filler at all.
Sure.
Yeah, it's just you have to find a good practitioner that
And
know
understand
what they do.
it better.
Exactly,
Yeah.
understand the anatomy, and then you have to make sure that you advise the patients well. Like when they come back like 6 months later, they probably just need like 1 or 2 syringes rather than like 10 or like 12 syringes. So yeah, always my principle is like underdo,
Yeah.
and then if it's not enough, we can always do top up.
Yes.
Right?
Less
Rather
is
than
more.
reversing.
Less is
yeah,
more.
Less is
yeah,
more.
Exactly.
Yeah, I used to live in LA, and I remember. I mean, I've never had anything done, but some of like these people that come back like after like a holiday or something, you know, and they come back into the office, and you're like,
What happened to you?
exactly did you do? You don't look the same. And then of course they're like, oh, I had filler or Botox or whatnot, and it's
Yeah.
just, I think at that point in time, it was just maybe they weren't as well versed or whatnot,
Yeah.
and I think you would just look very. Yeah,
Very fake and plasticky.
yeah. And then it was very difficult for her to make facial movements.
Expressions.
And like,
Yeah,
exactly. And so
yeah.
it was just stuck. And I was like, okay, did you like that or did you not like that? I can't quite tell.
You
Because she
don't
was
want
trying
to say that they look
there was no,
bad.
yeah, exactly. I was like, I don't
Is that
know.
what you really wanted?
Yeah, exactly.
That's usually like a combination of like too much Botox
Yeah.
and too much filler.
I don't
That's
know.
usually what happens. Yeah.
That lady was a
so you
head
cannot
case.
frown. Oh my god.
I'm glad the times have changed.
I know, like I mean, it was very interesting. I was like, I think that was my initial encounter with it,
Reaction,
which is
yeah.
why I'm like just
And you get turned off.
Yeah, I'm
because
turned
of
off.
that,
Exactly,
Right?
that
It's like I
totally
will
turned
never
me
do
off.
this kind of
yeah.
treatment.
Plus, and then she told me how much pain there was in it. I was like, oh my god, what? Well, forget it then. Why would you do that? So she told me no pain, no gain. I was
Beauty
like,
is
I don't
pain.
know.
Some patients say that.
Yeah, exactly. They have to say no pain, no gain. I'm just like, I don't know how I feel.
Actually, move on to some myths that we like to debunk.
Yes.
Did you want to start the first one?
So one of
Yep.
the first myths
Yep.
about vaginal
Mm-hmm.
is that you can't have vaginal rejuvenation if you haven't actually had kids.
You can't have it.
Yeah.
That's the myth.
That's the myth.
That's a myth. Okay.
So you can,
you
right?
can, yeah.
So it's not only because you've had kids that you can come look for you.
No.
Okay.
Because
But do you have to have it after you've had all your kids?
no.
No.
Especially for the non-surgical one, you don't have to like, okay, I'll close my factory, then only I'll do it, you know? You can do it in between, because you don't know when you're going to get pregnant the next time. But if it's affecting your, intimacy, then you can always do it. But always wait for about 3 to 6 months after delivery if you have childbirth. If you don't, you can have it anytime if you have issues. I mean, just like what we say, like genetic lottery, you just
Yes.
don't know. Yeah.
Yeah.
And also, people who don't have kids, they will also go through menopause.
Yes,
Right?
true.
Yeah.
Right.
That's true.
Right.
So, yeah,
Okay, so you can do it.
of course you can.
Is there an age limit as to when somebody can come?
Is there like a point
Yeah.
where there's no turning back?
Yeah, exactly. Yeah, exactly.
I think they're better late than never.
Better late than
But
never.
always come in with an open mind. I mean, as I say, we'll assess the suitability.
Okay.
And if you have like severe prolapse and if you have contraindications, then yeah, you shouldn't do it. And then you can go to like the urogyne or the gynae that can help to improve.
Right.
Yeah.
Got it.
Is it a myth that vaginal rejuvenation is purely cosmetic?
Totally a myth. Totally a myth. I mean, When you rejuvenate your vagina, you don't really see it, you just feel it. But of course, there's also other treatment like the surgical ones that really helps to improve the labia. We call it labioplasty. I don't do it, but the surgeons do it. But in terms of like radio frequency, vagina rejuvenation, it's not cosmetic per se, but it improves like your confidence and like intimacy with your partner.
Okay, very good. And another myth that we have heard a lot about with vaginal rejuvenation is that it's very painful and the downtime is long. That's the myth. Is that true or false?
Totally false, totally false. Okay, it's not painful. The probe is small, but it is meant to like emit the 360 degrees of like radio frequency energy, and it's just warm sensation. It's not painful, and there's no downtime with it. Okay, some patients do experience a little bit of discharge after, but it usually kind of like stop after about 2 to 3 days. Just kind of like clean properly, and then you're good to go.
Excellent.
Another myth. Vaginal rejuvenation is purely for the pleasure of your partner.
Ooh, totally myth. Totally myth. I mean, we talk about it. First and foremost, we help patients. Okay, so it's for the pleasure of the patients, for you and me. Okay, but with the tightening of the vagina, obviously it helps the partner as well. So both ways, both ways.
Perfect.
What an exciting topic that we were able to discuss today. Thank you so much for your time, Dr. Shirley. That was
Not
so
at all.
cool.
Thank you for having me.
Yes.
And thank you so much to our viewers, our listeners. If you have any questions for Dr. Shirley, be sure to write in. Let us know what you want to know and we'll get them answered. Thank you for joining us on And One Should Know.
Looking forward to seeing you next time.